This is Kevin Jefferson, the DC Foot Doctor, coming to you with the first episode of Friday Foot Facts. Today's episode will be about bunions. What are they? Where do they come from? And what can you do about them? Let's get to it. This gentleman came to me 2 weeks ago with a very common complaint that we see in podiatry, a painful bunion. He's a regular runner, and he was so concerned because the pain and the bunion deformity had increased so much, he has been unable to run for the past 2 months. These are his feet. As we can see, he has actually a bunion on both feet. A mild bunion on his right foot, but a more severe bunion on his left foot, which is his greatest complaint. You can see the difference between the two. You can see that on the right foot, he has space between the big toe and the second toe. But on the left foot, there is no space here. That's because the bunion has increased so much that the great toe has underlapped the second toe. Let's get to our patient exam. So how long has this been hurting you again?
This problem, about 6 years.
6 years. It's been getting worse over time?
Yes.
Okay. Relax here for me. Yeah, I mean, there's a significant difference between your right and your left. I mean, you have a mild bunion on your right foot, but your left one's really
it's a lot of different.
And so, as I go with your right foot, you know, I've got some pretty good movement. See how far I can take it up? That's normal. All right? And for you being a jogger, you need this range of motion. You need this much motion in here. And here, you don't have it as much. Still
Like
pretty
there,
close to
I
normal.
feel, not that I have my toe like that, I feel some pain.
So feel some pain. Do you feel it inside or on the side over here?
Inside.
Inside. Okay. So when you heard that? Yeah. Okay. So that means that there is some there are some joint changes. Okay.
But doctor, why that bones comes out?
So what happens is that over time, and this takes years to develop, as you get the joint changes here, the soft tissue, the tendons, the ligaments, the muscles, they contract, they shorten, and that pulls the big toe over toward the second toe. All right. And as the big toe pulls over toward the second toe, it forces the metatarsal, this bone that goes from about here to here, it forces this bone outward in this direction.
But that had nothing to do with the type of shoes we wear.
Shoes make it worse. Shoes typically don't cause this problem. It's not always just the shoe's fault. The shoes can make it worse if it gets to the point where the shoes are not accommodating, where the shoes aren't fitting around the problem. All right. Rarely the shoes cause a bunion, but they can make a bunion worse. So as we see here, you have, a mild to moderate bunion here on your right foot. You're not getting any pain here at all, right?
No, at all. No.
Okay. But here you see a big difference here on the left.
Yeah.
Right. And how much wider the right foot is than the left.
That's the reason I have to buy a bigger shoe.
But you have high pressure areas in the ball of your foot here, and here. That's where your calluses are. You have high pressure areas on your heel. All right. And now you have hardly any pressure in the middle of your foot. That's what you see when we have high arches. Hardly. There's no yellow, no red at all. None. Okay, that means you have a high arch foot. In this gait analysis, I take him from walking to running. As he speeds up, we can see the increase in force on his feet. Here in the slow-mo, we can really get an appreciation of that force. With his right foot off the ground, we can see all the force on the bottom of his left foot. So when we look at this gentleman's x-rays, we can see a number of things. First of all, he has a pretty large bump on the first metatarsal here, right in here. That's the actual bunion. That's what's causing his pain. He doesn't have much pain in the joint itself, but most of his pain is here when his shoes rub against his foot, especially when he's running. As we look at the lateral view of his x-ray, that is the x-ray from the side, we can see how much underlapping of the big toe he has of the second toe, looking at how much deformity he now has in the second toe. Here is the second toe. See how much it's sticking up. This is what we call a hammer toe. And he has this hammer toe chiefly because of the bunion deformity. The medical term for a bunion is hallux abductor valgus. Hallux is the big toe. Abductor is the big toe moving toward the little toe. And valgus is a rotation of the big toe out of its usual alignment, being flat on the ground. Treatment options include shoe modifications, including changing shoe size, making modifications to the shoes such as stretching the shoe and using liners in the tongue or in the heel of the shoe to make the shoe fit better if they have to go up a shoe size. Other options that we have are padding, bunion splints, and toe separators to better align the big toe joint. Are they a complete fix for the bunion? No, but they can make things more comfortable. Medications are also an option, including medications by mouth, medications topically, those pain relievers that you spread around the area to relieve pain, and steroid injections into the joint to help decrease inflammation if the joint is very arthritic. If surgery is being considered to address the bunion deformity and its associated pain, it is not to be taken lightly. There are cuts in the bone and shifts in the bone, and the patient can be sidelined for up to 2 or 3 months depending on what procedure is done. Procedures may be simple, such as removing the bump, or they may be much more complex, involving screws, pins, and plates. Now, in all bunion surgeries, removing the bump is always necessary. So outlined here in red is the amount of bump that will be removed for this patient. Now, some patients, because of the angle between these two bones, may need what we call an osteotomy, a cut across the bone to shift the bone into its new proper position. In this case, an osteotomy would cut right across the bone here, and then the head of the bone would be shifted toward the second metatarsal in order to get proper alignment. Now, if this is done in order to maintain alignment and to keep the bone in its proper place, it would need to be held in place with pins, screws, plate, or a combination of all three. Recovery time from surgery depends on the procedure that was done. All bone requires about 2 months to completely heal, regardless of the procedure. But if no hardware is put in and no osteotomy is put in, just a bump is removed, then the recovery time will be shorter, in the order of weeks. Now, if hardware is put in, there's been an osteotomy and bone has been shifted, then it can take 2 months or more to get complete healing and the patient return into their regular shoes. So if you're having pain or discomfort due to a bunion deformity, see a podiatrist as soon as possible. Have a good conversation with that doctor to see what your options are, be they conservative or surgical. Like this video with a big thumbs up and subscribe to the channel. Share this information with anyone you may know who's having a bunion issue. Watch the channel. Thank you for your support. And most of all, take care of your feet.